it's certainly difficult, making it difficult to treat, to deal with as we try and figure out this virus. Jessica DeMars is a physiotherapist, who has been working with those suffering from long COVID, trying to help them with their symptoms. And Jessica joins me now. Thanks a lot for giving us your time today.
Of a life well lived and service freely given that I most...
Jessica, what have you been seeing? What have you been hearing from the people that you've been working with?
Well, most of the people that I see have issues with breathlessness. Just because in the line of work that I do, I've typically been treating people with breathing issues. But by far the biggest, I guess, most debilitating symptom is fatigue. And it's not just fatigue. I did a little too much today and now I feel a bit tired. It's profound exhaustion where it is disabling. People aren't able to do basic activities of daily living.
And so many of them, I mean, that's such a great deal of frustration for them. And then so many of them not being able to go back to work, be able to sort of live their lives the way that they have. What is it that you've been trying to do to help them? Again, many of them trying to figure out their diagnosis as well.
Yeah, we don't really have a diagnosis because we don't really understand what exactly is going on. I mean, we know from past that there are issues with viruses where people, a percentage of people deal with long-term debilitating symptoms like fatigue, like ongoing flu-like symptoms, muscle aches and pains, things like that, and brain fog as well, what everyone's commenting on brain fog, so cognitive dysfunction. So that's been around in the past, but we still don't have good diagnoses for it. And so for me, helping people out right now, we're using what other populations have expressed to us, so other people that have experienced these symptoms after a virus, in that we have to rest, which is, in a time where we talk about exercise as medicine, and especially in my profession as a physiotherapist, we're always trying to get people moving. This is a total about face, and we have to allow people to rest and recover and deal with some of the other issues. We know there's autonomic nervous system dysfunction, so our autonomic nervous system, which controls our heart rate, blood pressure, digestion, breathing rate, things like that. There's dysfunction in there, so there's specific things that we can do to address that. There's specific things we can do to address breathing and shortness of breath. But above all else, the biggest message that we have to get out to people who are suffering longer-term symptoms is to stop, rest, and pace.
What about now we're looking long-term as we're sort of working our way, navigating our way as best we can through this pandemic, but long-term, not just for these patients, but when we're looking at some of the things that we need to have incorporated in the healthcare system for viruses, illnesses like this?
Yeah, and a lot of it comes back to getting really good diagnostics. I think we need to figure out what's going on. There are some indications that there's energy system disruptions and the autonomic nervous system disruption. We don't have good diagnoses. We don't have good treatments for that. So it kind of starts with that. In the meantime, all we can do is really manage symptoms. And for some, long term, they may not get better, and they may not return to what they were doing before. I certainly have people that have been sick for a year now and off work and not able to even do what their normal daily activities would be, let alone trying to work. There will have to be a big shift in terms of what kind of compensation we have for people that aren't able to return to work. How can we accommodate basically chronic illness and ongoing disability into a reduced workload, if that's even possible. I mean, it's really quite astounding, the prolonged effect that this is going to have when we look at minimum 10% of people infected with COVID could be experiencing these. And in fact, numbers now are showing more towards 14 to 17%. A lot of this is in our working population. This is going to be a huge fallout from this.
Yeah, no, certainly. And as you say, the long term and the work that's going to need to be done is going to be astounding, certainly. Jessica DeMars, a physiotherapist working with those suffering from long COVID. Jessica, thank you so much for giving us your time and the work that you're doing with these patients.
Thanks for bringing it to attention.
You're welcome.